Hello, Cambia. My name is Danielle. I'm part of the HR wellness team here. And today we are joined by our partners at Med Savvy and Sherry in particular, who's going to take us through acid reflux and heartburn. Without further delay, Sherry, take on these topics.
Thank you. Again, my name is Sherry Willard Argyris, and I'm a clinical pharmacist for MedSavvy and Journey. And today's wellness webinar is Got Acid Reflux or Heartburn? Next slide. Today, we're going to talk about the treatments for heartburn and gastroesophageal reflux disease, or for short, we call that GERD. We're going to talk about why there's such a large interest in treating GERD and how heartburn differs from GERD and the causes of heartburn and GERD and the symptoms, and when it's important to see the doctor and how GERD is treated. Next slide. First, what is heartburn versus GERD? Next. Heartburn, which we also call acid reflux or acid indigestion, happens when your stomach acid comes up into the esophagus, and that's the pipe from the throat to the stomach. And when that acid touches the lining of the esophagus, it causes this kind of painful burning feeling in the middle of the chest, right about the breastbone or just below the breastbone. But I like to use the term acid reflux rather than heartburn because heartburn describes that symptom of that burning feeling. But acid reflux can happen even without heartburn. It's just one of several symptoms that can occur, and many people don't have heartburn, but they do have acid reflux. The medical term for acid reflux is gastroesophageal reflux. So throughout this presentation, I'm going to use the term acid reflux or GER. Next. Gastroesophageal reflux disease is GER that is long lasting, and it becomes a disease because there's internal damage that's happening in the esophagus. And gastroenterologists can often see that by putting a little camera down the esophagus, and they can see a little red ring going on, which is some inflammation. And so they know that there's acid reflux going on into the esophagus. And then that's when we call it GERD. And if that happens, acid reflux happens more than just a couple of times a week for a few weeks, then it might be GERD. But GER, on the other hand, or acid reflux, is really quite common, something that we all have occasionally. And if it just happens occasionally, no worries. But if it starts happening more frequently, that's something that should be looked into. Next. Why is there such a large interest in treatments for GERD? Well, there are three reasons: disease prevalence, medical costs, and medication inappropriate use and overuse. So starting with disease prevalence, GERD affects about 20% of the population, which is quite large. In the Western world, we have a larger percentage of people with GERD than in other places in the world, and that's increasing by about 4% per year. And that's in parallel with our increasing obesity rates. Next is medical cost. A 2015 review of economic impact of GERD and its complications estimates that the use of proton pump inhibitors, which is one of the more common medications used for GERD, accounts for $12.4 billion of $18 billion in total direct costs of the condition. And next we have medication inappropriate use and overuse. We don't want medication inappropriate use or overuse to occur, but that's quite common when it comes to proton pump inhibitors. Inappropriate use and overuse is an issue because we don't want people taking medications that may not be benefiting them. They can lead to side effects that also can lead to missing other more severe conditions that may be occurring, and say the medication is covering up a larger problem, and then the larger problem isn't being addressed until perhaps it's too late. Also, it costs us money to buy medications that aren't doing us any benefit. So that's why inappropriate use and overuse is discouraged. But it happens quite frequently with proton pump inhibitors, unfortunately. A 2010 study found that 36% of people prescribed a proton pump inhibitor had no documentation of appropriate use, and 49% of the people who were given a proton pump inhibitor based on symptoms of GERD, which is okay because that's part of the process. Um, for diagnosing GERD is giving a proton pump inhibitor and seeing if the symptoms go away. However, doing that and not coming back and looking to see if there's any benefit being provided or whether or not the person can stop their proton pump inhibitor is a problem, and it leads to lots of refills of medication. And it's been found that people end up staying on proton pump inhibitors an average of 3 years without having any reassessment. Next. Well, not surprisingly, the #1 campaign alert for med-savvy users is about proton pump inhibitors. We want people to know that if they're taking a proton pump inhibitor for more than 8 weeks and haven't seen the doctor to have a reassessment, that they should do that to find out if the medication actually is benefiting them, if there's something else that's going on that might be more serious. So that's why we send med-savvy users alerts about proton pump inhibitors because it is such a problem of inappropriate use and overuse. Next. But what are the causes of GER and GERD? Well, this is a picture of the gastrointestinal tract. And if you look up at the top, there's this long, skinny pipe-looking area. That's the esophagus running down from the mouth to the stomach, which is about in the center of the slide. And right between the esophagus and the stomach is this little white line. And that little white line is called the lower esophageal sphincter. The lower esophageal sphincter is like a gate or a door that it allows food to come down through the esophagus and into the stomach. And then it's supposed to close off again to keep the stomach contents and acid in the stomach from coming back into the esophagus and causing damage. So when that lower esophageal sphincter isn't working properly, if it weakens or if it relaxes when it's not supposed to, that allows the stomach contents, including the acid, to come back up into the esophagus. Next. What are the causes of a weakened or relaxed esophageal sphincter? Well, they include being overweight or obese or pregnant because this places pressure on the abdomen and causes the lower esophageal sphincter to open more frequently than it should. There are certain medications that can cause the lower esophageal sphincter to relax more often, including antihistamines, certain types of blood pressure medications, and sleep aids. Smoking or breathing a lot of secondhand smoke also can cause the sphincter to relax. And having a hiatal hernia, that's when the upper part of the stomach uh, goes through the opening in the diaphragm up into the esophagus. And this obviously can cause the sphincter to relax more often. Next. Now, what are the symptoms of GER and GERD? Well, symptoms of GERD include persistent heartburn, which we've talked about. It is a common side effect for people with GERD, but an even more common side effect is regurgitation. And that's when you taste food or stomach acid in the back of the mouth. And this isn't a good thing because that means that stomach acid is traveling all the way up toward the mouth. And this can lead to bad breath. It can lead to the enamel on the teeth wearing away and causing dental problems. Other symptoms include nausea and vomiting, pain in the chest or the upper abdomen, and difficult or painful swallowing and breathing problems. But some people have no symptoms of GERD at all. And when that happens, usually GERD is discovered what we call incidentally. That's when the doctor is looking for something else and happens to discover that the person also has GERD. Next. A GERD, when it's left untreated, can lead to more serious health problems over time, what we call complications. So some of those complications include esophagitis. That's inflammation of the esophagus. So when the gastroenterologist looks down into the esophagus with a tiny little camera, and they see that redness, red ring around the esophagus, that's the inflammation going on and damage going on in the esophagus. This can also lead to esophageal strictures, which is narrowing of the esophagus and lead to difficulty swallowing or painful swallowing. Respiratory problems can happen when stomach acid reaches the lungs. That can cause long-lasting dry cough, a sore throat, a hoarse voice, asthma, um, pneumonia even, and wheezing. And finally, Barrett's esophagus. That's a pretty serious condition. That's when precancerous changes happen to the cells that line the esophagus. So if you think you have undiagnosed GERD, you should definitely see the doctor. Next. So when should you call the doctor if you have GERD? So if you have GERD symptoms that have been going on for a couple of weeks and you've been using over-the-counter medications, you've been trying out diet and that's not helping, give the doctor a call. If you've already been advised by a doctor to take proton pump inhibitors and you've been taking them for 6 to 8 weeks and you still have GERD symptoms, call the doctor. And finally, if you have alarm symptoms, definitely call the doctor. And those alarm symptoms include those coming up next. If you're 60 years of age or more and you have new onset upset stomach, if you have blood in your stools, if you have lost interest in eating or you have unexplained weight loss, if you have close relatives who've had gastrointestinal cancer, if you're vomiting up green or yellow vomitus with blood, or if it's forceful vomiting, or if you're having trouble breathing after vomiting, have sores or pain in the mouth or throat when eating, and have problems swallowing or painful swallowing, then give the doctor a call. Next, how are GERD or GERD treated? There are 3 ways: lifestyle changes, medicines, and surgery, or a combination of these. Most commonly, doctors prefer lifestyle changes and medications to surgery. Surgery is often a very last choice when it comes to treating this condition. And the treatment depends on how severe the symptoms are, whether there are any underlying causes that can be corrected, and what your preferences are as a patient. So today we're going to focus on lifestyle changes and medications. Lifestyle changes include losing weight if you're overweight or obese, wearing loose-fitting clothing around the abdomen so you don't have that pressure on the abdomen from constrictive clothing, staying upright for 3 hours after a meal and avoiding reclining or slouching in a chair after a meal, not eating 2 to 3 hours before bedtime, sleeping on a slight angle by raising the head of the bed by 6 to 8 inches, and there are wedges that can be purchased to be put under the mattress, or you can take blocks and safely put them under the feet of the bed at the top of the bed. Uh, Pillows, you might wonder, could that work? And the answer is no. Just using pillows is not helpful. We really need to get that angle going most of the length of the bed. Also, quitting smoking and avoiding secondhand smoke, avoiding overeating, and instead eating small, frequent meals instead of 3 large meals, and avoiding eating or drinking foods that can cause symptoms. Here are some common foods I've listed that can cause symptoms for many people, such as chocolate or coffee or tea or other caffeinated beverages, peppermint, fatty or spicy foods like sausages, donuts, pastries, tomato paste, tomato sauce, lemons and limes. And there are others. Um, but most importantly, any food that causes you symptoms is a food to avoid. There are many lists online of foods that commonly cause symptoms, but it's good to keep a diary because you might feel like, oh, can I eat anything anymore? And the answer is yes. You know, for example, if chocolate doesn't cause you symptoms, then you'll be able to eat chocolate. Um, but if onions cause you symptoms, avoid onions. So it's good to keep a food diary, keep track of what you've been eating throughout, you know, a few weeks or several weeks. See if you see any patterns with when you have GERD and avoid those foods. Next. So there are 3 types of medications that are commonly used to treat GERD. They include antacids, what we call H2 blockers or H2RAs, and proton pump inhibitors. Next. Starting with antacids, many of these are available over the counter, and they work by counteracting or neutralizing the stomach acid, and they're used short term or for as needed relief when you have symptoms, but they're not recommended for continuous or long term use due to their side effects and also the frequency with which you'd have to use them to make them useful. So examples of these include aluminum hydroxide plus magnesium hydroxide preparations, such as Mylanta or Malox, calcium carbonate, such as Tums or Rolaids, and notable side effects with taking antacids include diarrhea and constipation. Next. The next class of medications we use for treating GER and GERD are H2 blockers. These are, most all of them are available over the counter. They act differently from antacids. They work by getting the stomach to lower acid production instead of physically neutralizing the acid. And they are commonly used short term or for as needed relief. They also can be used throughout the day and for long term use, unlike antacids, but they are less effective than proton pump inhibitors. Example of a H2 blocker is famotidine, also called Pepcid. Notable side effect of H2 blockers is tachyphylaxis. The tachyphylaxis happens when you've been taking a medication for a while and the medication just stops working or stops working very well. And this can happen with H2 blockers uh, as early as 3 days to 30 days after starting use of the medication. Our next class of medications is proton pump inhibitors, and some of these are available over the counter, others are not. Proton pump inhibitors also work by lowering the stomach's acid production, and they're best for treating symptoms continuously and for healing the esophagus if you have, you know, that inflammation of the esophagus going on. Doctors also often prescribe this to treat the complications of GERD as well as GERD itself. An example of a proton pump inhibitor is omeprazole, also called Prilosec. Notable side effects include gastrointestinal bacterial infections with long-term use, also rebound acid when stopping them. So what rebound acid is when you stop the proton pump inhibitor and the stomach acid comes back bigger and badder than it was before starting the proton pump inhibitor. So to keep that from happening, for people who have been using proton pump inhibitors for several weeks, we recommend that people, step down off of them gradually, gradually lowering the dose, gradually lengthening the time between doses, filling in with antacids and H2 blockers um, to, to hold off that rebound acid. Next. So here we have an example of a doctor's approach to treatment. There are many examples of treatment approaches. This is one of the more common ones. It's called step-up therapy. So if you have suspected GERD, and first the doctor will recommend lifestyle modifications, which we talked about before, dietary changes, weight loss, and such. If you have symptom frequency of less than 2 times per week, the doctor will recommend an antacid or an H2 blocker as needed. Next, the doctor would recommend a low-dose proton pump inhibitor if the antacids or H2 blockers are not working. And then hopefully if the low-dose proton pump inhibitor works, you can step down off of that proton pump inhibitor and fingers crossed, stop the medication altogether. But if symptoms frequency is 2 times or greater per week, then the doctor may start with the low-dose proton pump inhibitor. And if that doesn't work, move to high-dose proton pump inhibitor, and hopefully that'll work. And if it does, again, stepping down to the lowest effective dose or stopping. If it doesn't work, then we call that refractory GERD. And if refractory GERD happens, then more investigations are needed. That means laboratory tests, checking to see if there's acid that can be found in the esophagus, doing imaging such as an endoscopy or an ultrasound. Next. So again, just a reminder, call the doctor if you have GERD symptoms that do not get better with over-the-counter medications or dietary changes after a couple of weeks. If you have GERD symptoms after 6 to 8 weeks of a doctor-recommended proton pump inhibitor, or if you have alarm symptoms. Next. So how can you find out more about this presentation, ask questions, find out more about the medications and other medications? Well, you can go to MedSavvy, where there are licensed pharmacists such as myself and my colleagues who provide content in MedSavvy. We describe the effectiveness and safety of medications. We grade medications in sort of a report card style ABC format to let you know which medications are most effective for most people. And you can sign up or log into MedSavvy by following these directions. You can also go on Journey as well. And you can just pause the presentation or come back to the presentation and take a look at how to sign up or log into MedSavvy so you don't have to write that down real fast. Next. And when you go into MedSavvy, if you want to look up information about GERD treatments, go to Heartburn. We filed that under the most commonly used term for acid reflux. You can also type in acid reflux or GERD, and it will also take you to the Heartburn area of MedSavvy. There you can compare treatments. If you're interested in particular categories of treatments, you use our filter under treatment category. In this example, proton pump inhibitors is selected. As you can see, they're all graded A because they are the most effective, but are most commonly recommended by doctors when continuous use is needed of a heartburn medication. And they're all very similar in their effectiveness. There's not really much distinguishing them. Next. Or you can also, by going to MedSavvy or Journey, you can click on the Ask a Pharmacist button, and you can ask me questions via Ask a Pharmacist about acid reflux medications or any other medications that you're interested in asking questions about. Next. These are the references that I used today. I find that the National Institutes of Diabetes and Digestive and Kidney Diseases site, NIDDK, site is a really helpful site. Some of the other resources can only be fully read with a subscription service, but you can see summaries of those. But if you want to go back and take a look at anything I talked about today, you can try to access the resources or simply contact me through Ask a Pharmacist. So I'd like to thank you so much for coming today to this presentation, and I look forward to hearing from you through Ask a Pharmacist. Take care. Bye-bye.